Hello and welcome to the Breathwork for Health Coaches series video on blood pressure control. My name is Kathleen Helen Lisson. I'm a lymphedema therapist. I'm board certified in therapeutic massage and bodywork. I'm an ACE certified health coach, also a yoga teacher, and the author of a few books, including Stress Reduction for Lymphedema and Mindful Strategies for Adults with Adverse Childhood Experiences. And I first became interested in blood pressure control in my role as a lymphedema therapist. So we're going to be practicing some breath work today. It's going to be pretty simple breath work, but still, if you have anxiety, breathing problems, cardiovascular, blood pressure issues, or anything else that would preclude you from doing breath work, definitely listen to the informational part of the video, but go ahead and wait to do the breath work part until you have received clearance from your physician. And even if breath work is usually very comfortable and nourishing for you, if today, for any reason, you feel anxiety, lightheadedness, dizziness, rapid heartbeat, shortness of breath, or any other symptoms that are negative to you, go ahead and stop the breathwork portion. You'll always have this video if you just want to try to do the breathwork at a later time. And it's best to practice this type of breath work on an empty stomach. You can try practicing it in the morning or before exercise or breakfast. And that's usually because we're doing a little bit of deep breathing, and that can put some pressure on the stomach and cause some discomfort if you have a stomach full of food. So let's begin by talking about the link between hypertension and the sympathetic nervous system. So we know we have different parts, we like to say, of the nervous system. The sympathetic nervous system is that fight or flight nervous system part that helps us gear up, run away from the tiger, attack. That's the nervous system that helps us do things when we're in danger. And then there's the parasympathetic nervous system, the rest and digest nervous system, the one that helps in repair, the one that we want to be in when we want to reduce stress and feel relaxed. So we're talking about the sympathetic part, that fight or flight part of the nervous system. And this presentation is going to be research-based. You're going to see quotes from research, and then at the end, you'll see a slide with all of the resources, so you can go ahead and look at these studies in their entirety. But research from 2024 shares that hypertensive patients have elevated levels of vasoconstrictors, such as vasopressin, and neurotransmitters like 5-hydroxytryptamine, 5-HT, in their blood and tissue fluid. And these neurotransmitters maintain continuous excitation of the sympathetic nervous system, making edema more likely to occur. So we see the researchers sharing there are some elevated levels of neurotransmitters, and that is actually having the nervous system of the hypertensive patients be more into the excitation of the sympathetic nervous system. So what does that mean for my clients and perhaps your clients who have a breast cancer history or any type of cancer history? And the researchers say long-term regulation of arterial blood pressure primarily occurs through the renal fluid control system. And after breast cancer surgery, extracellular fluid accumulates, that is fluid outside and in between the cells. Extracellular fluid accumulates, increasing circulating blood volume and disrupting the balance between circulating blood volume and vascular capacity. So how much blood volume there is and how much blood volume the system can handle. And when you disrupt that balance, it can further elevate arterial blood pressure. So this is interesting research that shares if someone had surgery for breast cancer and then they have some of these extracellular fluid accumulating, that can elevate their arterial blood pressure. And it's also about the veins. It's not only about the arteries. The researchers continue, hypertensive patients experience increased fluid entry into the tissues through the veins. So the veins are pushing more fluid into the system, which leads to greater tissue fluid formation. And postoperatively, when lymphatic return is restricted and compensation is lost, breast cancer-related lymphedema may be triggered. So what is happening is, as they say in this paragraph, if you have hypertension, there may be more fluid coming into your tissues from your veins, and your lymphatic system is the system that takes the fluid away from the interstitium and returns it to circulation. So if you have lymphatic return restricted and compensation of the lymphatic system is lost after breast cancer related surgery, it may affect the person's lymphatic system. And if it does affect the person's lymphatic system and these veins are pushing more fluid into the system, you may end up with breast cancer related lymphedema. And that is why hypertension is a risk factor for lymphedema. So this is why I'm so interested in this topic and why I want to share information about it with you, because blood pressure control is essential, and it's essential to everyone, not just people after breast cancer. So I'd love for health coaches to know more about this and help our clients to reduce their blood pressure. So the researchers conclude, therefore, it is essential to effectively control hypertension in postoperative breast cancer patients through medication or other means. But it's very important to note, if they have breast cancer, calcium channel blockers should be avoided, as they can easily induce upper limb lymphedema after surgery. So, of course, make sure that the person prescribing the hypertension medication knows about your client's health history, especially if they have had breast cancer. So let's look at some non-pharmacological things that we can recommend to our clients in addition to what they're doing, and reinforce what they're doing with their physician to control their hypertension. So we'll look at research from 2023 titled Breathing Exercise for Hypertensive Patients, a Scoping Review. And these authors state that slow, deep breathing can be a non-pharmacological alternative therapy for people with hypertension in addition to their lifestyle modification. Slow, deep breathing is easy for people of all ages and does not have to be expensive. And this research that they published gathered 20 studies on the benefits of breathing exercises in hypertension patients. So these researchers say patients diagnosed with hypertension often exhibit hyperventilation symptoms even during rest periods. So this will be very interesting to us to kind of have the answer for us if our clients are like, I have hypertension, why am I hyperventilating? Why do I feel like I'm hyperventilating even when I'm seated? And then that, sometimes people will take that symptom of hyperventilation when they're at rest to increase their fear in doing exercise. And we know exercise is so valuable for them. So this is very valuable information for us as health coaches, and also any personal trainers would love to know this information as well. So the exhibition of hyperventilation symptoms, having the hyperventilation symptoms when during rest periods, if you have hypertension, it suggests, the researchers say, that cardiorespiratory abnormalities observed in these individuals may be linked to that shared excitatory pattern within the autonomic nervous system. So that first slide that we looked at that says there's more sympathetic nervous system excitement if someone has hypertension. So it may be that their sympathetic fight or flight nervous system is on, and that's why they're having these hyperventilation symptoms even when they're at rest. And so these researchers state, again, great evidence for us, it is possible that adopting a slower breathing rhythm could potentially regulate these abnormalities. And we'll look at the research here, and it's a very old research study. So we've known this for quite some time, for over 20 years. And it's this study titled Slow Breathing Improves Arterial Baroreflex Sensitivity and Decreases Blood Pressure in Essential Hypertension. And these authors say that slow breathing at 6 breaths a minute increases baroreflex sensitivity and reduces sympathetic activity and chemoreflex activation, suggesting a potential beneficial effect in hypertension. So more things that we can put in our toolbox when we're talking to someone about the value of slow breathing, especially, as these authors said, 6 breaths per minute. Let's look more detail into the same study. The authors stated that during spontaneous breathing, hypertensive subjects showed lower carbon dioxide and a faster breathing rate, suggesting hyperventilation and reduced baroreflex sensitivity. So even in their natural breathing pattern, they're having less carbon dioxide and a faster breathing rate than perhaps people without hypertension. The authors state that slow breathing reduces blood pressure and enhances baroreflex sensitivity in hypertensive patients, and these effects appear potentially beneficial in the management of hypertension. So more evidence that maybe this slow breathing can be a part of our client's self-care practice. So let's try it. We've looked at some research. Let's see what they're talking about. Let's try this 6 breaths per minute. So I'll invite you to get into a relaxed yet alert position. Your eyes can be open or closed. And for this breathing practice, we are going to breathe at 60 breaths total. It'll be a 10-minute breath, 5-second inhale, 5-second exhale. So it'll be 6 breaths per minute, and we will be doing it for 10 minutes. I'll go ahead and start our stopwatch here. So we'll go ahead and start with an exhale and then inhale and exhale. Inhale and exhale. Breathing can be through the nose or through the mouth. Inhale and exhale. 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 Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale Exhale. Inhale. 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 We're about 5 minutes or halfway through. Exhale. Inhale. 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 1 minute left. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Okay, that is 10 minutes of 5-5 breathing. And I'll have us just breathe normally for the next few minutes, moments, breaths. As we let go of this deeper breathing, longer breathing practice. And then I'll invite you to feel the effects of it in your own body. How do you feel in your body after this 10-minute breathing practice? How do you feel in your emotions? Are your emotions different than they were before you sat down to watch this video? And your spirit, how does your spirit feel after this breathing practice? And do you think it's something that you could recommend to your clients as a health coach? It's a simple practice and it really changes the sympathetic nervous system into the parasympathetic nervous system dominant. We can feel that in our bodies by feeling the change in our emotions, the change in our muscle tone. Is this something that you might want to practice maybe for a shorter duration, maybe just a minute or two of this practice with a client who comes to you to kind of let them get a taste of the practice and then encourage them to add it to their self-care practices? And if you're interested in learning more about breathwork and the different ways that breathwork can help, especially after the diagnosis of cancer, if someone has lymphedema, and just for general lymphatic wellness, I have a free 10-session breathwork and lymphatic wellness class which is at this YouTube channel at Stress Reduction for Lymphedema. And I'd like to thank you for watching this episode of the Breathwork for Health Coaches series. You can find my books on Amazon if they help your clients who are coming to you for health coaching. That is amazing. I would love that. I am author of the Lymphedema Treatment Guide. I'm also a co-author of the Standard of Care for Lymphedema in the United States document. So that document is available by searching for it on PubMed or Google Scholar. It's available free full text just by typing in Standard of Care for Lymphedema in the United States. You can see all kinds of information on lymphedema. And then I also have a book, the Lymphedema Treatment Guide, which is available on Amazon. I also have the book, Mindful Strategies for Adult Clients with Adverse Childhood Experience. If your client has taken, if you give them the ACEs score based on the ACEs study, which is also available free full text. It occurred in the 20th century. The initial one in San Diego at Kaiser and has been replicated so many times all over the world. So it's a really great science to understand what is happening to them in adulthood with chronic illness may be traced to childhood trauma. And then understanding that if you have a client that has adverse childhood experiences, that many of the common recommendations we have for mindfulness may not work for them. So I put together some strategies that may work for them in the book, Mindful Strategies for Adult Clients with Adverse Childhood Experiences. And then I also, as a lymphedema therapist, have a book, Stress Reduction for Lymphedema, that goes over the published research on stress reduction protocols from all over the world for people with lymphedema, both primary and secondary lymphedema and lymphatic filariasis. And that is in the book, Stress Reduction for Lymphedema. And these books are available on Amazon in paperback and Kindle. And if you want more information on stress reduction, you can find me on Instagram at Stress Reduction for Lymphedema. Thank you so much and have a great day.